Preservation facelift, also known as preservation deep plane facelift, refers to a novel facelift technique aimed at rejuvenating the face while preserving the natural appearance, reducing recovery time, and avoiding over-resecting the soft tissue and skin undermining while addressing the deeper layer of facial muscle. This technique combines the high SMAS facelifting with extended deep plane facelift to eliminate the over-resection of skin. With the extended deep plane, the surgeon normally lifts the skin up to the interior of deep plane here, here, and here in order to have access to the deep plane. Whereas high SMAS, the surgeon only lifts the SMAS in this area up to the interior of deep plane and lift just the SMAS this way without entering to the deep plane. So I go under the SMAS in this area, move forward, then undermine the SMAS again in this area to go deep plane. Then I lift up the SMAS high up to a higher position and resuture it back to newer position. So the excess skin here is going to be trimmed with no dead space here. So the tissue heals well, the incision lines heal perfectly. Preservation facelift is performed under Twilight Sedation without the need for general anesthesia, meaning IV sedation and local anesthesia. Preservation facelift technique is truly the next generation of facial rejuvenation, which produces long-lasting, natural-looking results and faster recovery compared to all other facelift techniques. If you're interested in facial rejuvenation, please contact my office. I'll be delighted to help you explore your options. If you enjoyed this video, please like it and also subscribe to my channel to see more videos like this.